Hi guys. So I am doing the extra credit current topic presentation this week, and I chose to focus on the mental health status in the United States. This is something that is a big, part of why I want to become a social worker. So some statistics that was found, this article came out in 2022, I believe. Depression has gone up 28% across the nation amongst adults. Anxiety has gone up 25%, again, against adults across the nation. 21% of adults in the U.S. experience mental health conditions, and the decline in mental health has caused upwards to $1 trillion lost in productivity simply based on not being able to go to work or not being able to function within society and needing to go to inpatient as a help to kind of combat the mental health. The Biden administration has this thing called the Unity Agenda, and it was interesting to learn. Biden makes it to where health plans are they are required to cover mental health care. A lot of insurance, they may only cover so many appointments in a month or in a year. They may not cover it at all. They may only cover therapy, but not medications. So this was to view mental health care as important as your physical health care, your dental, and your vision and such. It is also requiring that insurance covers the loopholes. This makes it to where it is less restrictive on needing prior authorizations or other medical management techniques, making it harder for those that are seeking help to get help. This also makes it easier to understand what your insurance is actually covering and not having to Google or look up a dictionary every time you don't understand a word. This is to put it in layman's terms so it is understood by everybody. It is also meant to require that mental health is equal to physical health. This way, they are seen as, affecting each other because, as we've all seen and as we, may experience, poor mental health can lead to poor physical health. This rule shows that would allow more than 200 additional health plans, which would also allow 90,000 consumers to gain protection and access to mental health care. COVID has been a big impact over the last 3 years. It has caused a fear factor, which is maybe part of the reason why our anxiety increase is going on. It is an increase in mental health conditions, especially for healthcare workers that have been around the effects of COVID-19 day in and day out over the past 3 years. They've had to deal with watching patients just pass by themselves alone without family, the exhausting and mentally and physically draining shifts that they had to occur or endure while they were at work, along with just the general society. Humans aren't meant to be solitary confinement creatures. So when the world was shut down, it caused, a lot of realizations about things that may have been very deep or had been overlooked by being able to hang out with family and friends and go do all of the fun activities out in the world. When the world shut down, it also led to an increase in abuse. Nobody knows what's going on behind closed doors except those behind them. So this led to an increase in domestic abuse and mental abuse, along with the emotional abuse that can come with all those, not to mention all the children that may have gotten food when they were in school versus at home they didn't have access to it, or they didn't have access to adequate amount of food. The economic impact can also increase the mental health conditions, trying to find the new way to survive in the inflation and in the limitations that were still there as the world was starting to open up, not to mention all those people whose job was put on hold simply because they were not deemed as essential employees or essential fields that they work in. So they didn't have a job. They were living off unemployment. And while that was, fine and dandy for the time, the uncertainty of what would be next can also cause anxiety. So today's resources, as a social worker, we have ways to help others. We have things like maybe pamphlets or informations on hotlines. Thanks to new technology, hotlines are able to be reached, whether it be via phone, chat on the computer, or text messaging. I know now a lot of 911 operators are implementing a text type way to report 911 emergencies. Even if that is a mental health crisis, it will still allow that person to get access to help. There are also various therapy options. There is therapy over the phone, virtual, online therapy through kind of like an IM chat, where it is through a secured site and you only talk to your preferred therapist that offers that, along with in-person therapy as always. And then there are also various support groups. There are support groups for anxiety. There are support groups for depression, support groups for, loss and grief, and just people that want to help and just hear you out. There's judgment-free zones. Big advocate for, not being afraid to reach out when you need assistance. Social workers combat mental health by connecting clients with various resources, like the many inpatient and outpatient resources that clients might not realize that they have access to, or they might not know how to go about getting those outside of getting admitted through the ER at a psych facility or at a hospital with a psych floor. We are able to be counselors and therapists and listen and assist clients work through the mental conditions, and maybe kind of put the pieces together of how the domino effect is happening. And, maybe the mental health is the beginning part of that domino effect and they'll need to get that under control. We can assist by getting the clients into programs. We can also assist in getting families and clients to create treatment plans. This also can come with, maybe a mom doesn't know exactly how to help their teenage child who is showing signs of depression, and maybe their medications aren't working, or they don't want to get them on medications at such a young age. So they want to find more of a holistic type of treatment for it. Can allow brainstorming and maybe point out things that they may not have thought of to help their child. So my discussion questions for this are, what are some ways that you may deal with stressful situations? I know being a college student along with an adult and the way the world is today, there is stress everywhere. And then my next question is, do you believe that there is still a stigma around mental health? Do you believe that mental health is seen as, back in the day, it was seen as a white man's thing, or that if you have mental health, you're crazy. If you aren't happy and bubbly, then you must be sad and depressed all the time. Or if you have depression, then why are you at work and why are you smiling and being successful? I hope you enjoyed this. I And again, I'm a big advocate for mental health and taking care of it. So please don't be afraid to reach out if you would like an ear to listen. Thank you.